Eileen Carpenter.
I want to echo what Joseph Gaines has said in a completely different way. I am here to pay forward. I never thought I would come to the legislature again. In October of 1986, the father of my 5 children stopped paying child support. My oldest child was 9 years old. The youngest was still a year and a half nursling. Every program, most programs you're going to cut, not disabilities, I used to take care of my family. The programs that are now being on the chopping block nationally are also programs. The Community Action Program, the BASE program. I won't take up my time listing the programs. You know what they are. It is unconscionable. It is the wrong conversation for us to be having in Vermont. Joseph expressed for me, I didn't know what he was going to be testifying on, this concept of how we in Vermont promote ourselves as being humane, community-based, unifiers, leaders of the rest of the country. And the conversation I feel we should be having in Vermont's State House is, how are we going to raise the money to take care of our own when we know we have very little control over what's coming down the pipe on the national level? I am very fortunate in the timing that I raised my children. My children all went to the colleges of their choice. They're now successful adults. Some have choices of their own. None of them went through the correction systems. We have all had to use mental health, I shouldn't say all, some of us have used mental health services to get through hard times. I'm asking you to take the kind of leadership Vermont is known for, to make the tough decision to create a tiered tax system so that it is fair, and to, if you need to look for luxury taxes, professional services, rooms and meals taxes, places where some people can afford and some of the rest of us can't. And I want to appreciate also having time and you're taking the time to hear from our community.
Thank you, Mark Floyd.
Good afternoon. I'm Mark Floyd. I'm a resident of Montpelier. I'm the Director of School Counseling Programs at Lemoyle Union High School, and I want to speak to you today about the Student Assistance Program. In the administration's budget, the entire budget amount for the SAP program has been eliminated, and I'm concerned about that on several fronts. I think certainly Gretchen's story and Aaron's story are 2 stories that we who work with kids every day, all day long, here around suicide and around choices sometimes that students in schools make. SAP counselors provide a valuable service to our schools. They're the identified drug and alcohol expert in the building. They work with students who seek their services, with families who seek their services, with a school staff around training needs, with the administration around policy development and enforcement at times. To eliminate that program in its entirety from schools around the state, some 92, would have a potentially devastating effect on the work that schools are able to do and are being asked to do as we move forward with more and more programming and training needs around suicide and bullying prevention, and now with suicide prevention, with Act 1 around sexual abuse prevention. Many of those programs, many of that education, much of that training is done by and with the collaboration of the student assistance counselor in the schools. As what's been described an integral part of the prevention and treatment services delivery in the state through ADAP and through the Department of Health, to completely eliminate that, I'm going to refer to it as the leg of a stool, creates an imbalance and possibly something that is irreparable in terms of being able to recreate an infrastructure of some 20 years that we've worked hard to build with some success. So I don't envy at all your position. I appreciate the work that you all do and the support we've had in the past. and I would ask that you would consider the funding of the SAP program in the next budget. Thank you.
Thank you, Mark. Mike Polkowski. Mike Polkowski. Debbie Polkowski.
Good afternoon. My name is Debbie Haskins, and I live in North Calais, Vermont, and I want to talk to you today about the Student Assistance Program. First off, I do have my testimony. It's a lot of paper, a lot of information, but I'm hoping that you've already heard from someone in your community about what a Student Assistance Counselor is, so I'm actually not going to take my time to go down all of the things they can do. Your appropriations, so you're about money, so I want to talk to you about where our money is going. And many of you already know this, but I think visuals are worth a tremendous amount. I pay my taxes just like you do. And much like the previous stories that we're talking about is, as a useful, productive member of society, I have come here because maybe I've had an addiction and I've been able to get through it. And in that process, it's a lifelong illness. Talking to you about addictions today because a lot of the work that the student assistance counselors do is about addiction and getting folks into the right door. For every dollar that I'm paying for my taxes right now, 90 cents of that dollar, 90 cents is going for shoveling up the cost. So we all know in this committee where most of our money is going. It's going all 90 cents, so here it is, 90 cents is sitting in there and it's going to the ERs, it's going to the emergency rooms, it's going to the cost of corrections, it's going to all of those places. 8 cents is going for governance, for liquor control, for compliance issues, for making sure that those laws are enacted. 1 cent of my dollar is going for treatment, and 1 cent is going for prevention. And this is from the Center for Substance Abuse, 2005, our report, and I actually have it attached to show you. This 1 penny that goes for prevention has just been eliminated. The infrastructure for all of our work for 15 years at helping intervene on kids' life. I ask that you look at that and think about where this dollar goes, and do we want to keep shoveling up, or do we want to put money into prevention? Thank you. And it's on the, you want this dollar? You're going to need every cent you get. Well, I'm just going to leave the 90 cents right here because you can see where it's all going. It'll give everybody a chance to sort of see our piles. Visual.
Blame it on being a lefty, but it won't. Thank you. I am Sandy Gando, and we did not plan this, but I would also like to talk to you about the SAPs today. And I wear the hat of representing all the parents in the state of Vermont, one of 2 representatives that work with the Federal Substance Abuse and Mental Health Services Administration, trying to create a better adolescent treatment and support system. And on this wonderful little handout I gave you, because I live in Addison, Vermont, you might have heard that the Lake Champlain Bridge that we depend on very much imploded because the infrastructure was not taken care of. And I cannot help but feel that losing the SAPs in the infrastructure that we have created over the last 25 years is going to have much the same effect. SAP's positions, I can tell you, were not created without a great deal of evidence that there was an overwhelming need, and that need has not gone away now that funding is tight. As a parent, if my child has a health issue and I have no insurance and there's no money put away for a rainy day, that does not negate my responsibility for ensuring that they receive appropriate care. As we all do, we examine our budgets, our priorities, and the cost of not providing care. Our state's commitment to prevention efforts, to creating that infrastructure and developing the adolescent substance abuse workforce and the treatment system of the last 25 years was conceptualized much the same way. I can tell you that on a federal level, we are very far behind all of our other state partners and the tribal nations it is sometimes a little embarrassing and quite frightening to think that the problems that we are experiencing in Vermont, they were experiencing just a few years ago in our sister states, and they are further ahead because they have recovered high schools, they have mental health and drug courts, things that we don't yet have. Someday, maybe. The return on the investment that we've put into prevention and intervention is priceless. Every time a youth is referred to treatment and finds a path to recovery and wellness, when one youth is diverted away from corrections, when one youth stays with their family rather than entering foster care, and when one life is saved. And I have to tell you that the FACES organization that you see here was a board of 11 statewide parents, and 4 of those have lost children to the disease of addiction. So we are not a state that is not being touched. It begins in adolescence, and if we don't address it in adolescence, then we visit them other places. Thank you very much.
Thanks, Cindy. Okay, last call, is there anyone else who would like to testify? Okay, well, thank you all